Okay, welcome everyone. Thank you all so much for being here today. I'm Jamie. I am with Metro Council. Excited to have all of you on today. And welcome to our Mental Health KC webinar for June. A little bit about Metro Council. So we are a collaboration of all the community mental health centers in the Kansas City Metro, and we include the following organizations. So University Health, Beacon Mental Health Center, Wyandotte Behavioral Network, Comprehensive Mental Health Center, Rediscover Mental Health Center, SWOPE, Johnson County Mental Health Center, and then also Center for Behavioral Medicine and Mental Health America of the Heartland. So really excited to have everybody here today. And we provide education and trainings for our community and try to make it as accessible as possible. So again, thank you for being here. A couple little housekeeping things to note is that so this is our webinar. We always have it on the second and the fourth Thursday of the month from 12 to 1, except this month we're only having it on the second Thursday of the month. But with Zoom webinar, a couple things to note. You're only able to hear the presenter, not yourself. And you're only able to communicate through the chat box or the Q&A. So you can still communicate, you just won't see yourself. Then at the end of our time together, a certificate of attendance will be available at the end of the webinar. So as long as you stay at the end, till the end, you'll be able to get that certificate of attendance. And then we always do a little disclaimer that the views and opinions presented are those of the speaker and do not necessarily represent the opinions of Metro Council. So again, welcome everyone. A couple other things to note. We hope that all of you that attended the Mental Health KC conference, we hope that you enjoyed it. We're just kind of coming off that from a couple weeks ago. And we do have another event coming up June 27th. So if you are an educator or know of somebody who is an educator, we are having a free training for educators that's addressing school mental health and talking about student well-being and educator well-being. We're really excited to be partnering with mental health. So hold on, I got to remember their names. Mental Health Technology Transfer Center for Region 7. And really excited to have Dr. Hannah West, along with her colleagues that will be presenting and really doing the workshop all day. So if you or anyone else is an educator and would like to come to this free training, it is June 27th from 9 a.m. to 3 p.m. at Johnson County Arts and Heritage Center. So, and we are still accepting reservations. So as soon as I finish introducing Matt, I'll put that information in the chat. But with that, I'm really excited to introduce Matt Burton. I'm just going to give you a little bit of information about Matt. So Matt's going to be talking about how men experience mental health today. We're really excited to have Matt as part of Men's Mental Health Awareness Month, so which is June. And a little background about Matt. So Matt is an LCSW and has been working within the mental health field for over a decade. His compassion for people with mental health struggles was developed from wanting to help others live a better life. After seeing friends and family deal with mental health struggles, as well as his own struggles with anxiety and depression, Matt decided to get a degree in social work. And Matt received his Bachelor of Social Work from Park University and his Master's from UMKC. Within his time in the field, Matt has directed 2 adult day programs, ran IOP groups, did integrated assessments, and is now working full-time at Beacon Mental Health as a behavioral health therapist. So with that, really excited to introduce Matt,
Thank
and
you.
you're good to go.
All right. Well, thank you so much. I appreciate the introduction and just delighted to be here with everybody. And, certainly an important topic to discuss. Let's see. Do I need to share my screen again?
Yes.
Okay. Okay, so once again, thank you all for being here. June is a part of the Men's Mental Health Month, so wanted to kind of spend a little bit of time focusing and talking about that. Um, Not all of today's conversation is going to be solely focused on just men. I am going to point out some differences in some particular struggles for men. But as I move on, I did want to share some strategies to help anybody with mental health struggles. So I did include some of that. This is a pretty kind of general synopsis. I wanted to cover a lot of things in a short amount of time. Um, so we're not going to get real in depth in today's topic conversation, but definitely wanted to highlight and hit on some points. So without that, we will get going. Okay, so what are some of the differences between men and women in the mental health? So in in general, on average, there's about 1 in 5 adults who experience a mental health issue in any given year. Now, statistically, we know that does increase for college age students, and that number could be 1 to 3 to 1 in 4 for those college age students. And so, when we're talking about mental health, it's affecting a large amount of people. Um, but there are some differences between men and women and how they experience their mental health struggles. So men are more likely to go untreated and more likely to not seek treatment. As a result, statistically, women have higher rates of depression and anxiety, and perhaps part of that is due to men not seeking treatment and not having the data available there. um, Another issue that we'll discuss today with men is in not seeking treatment is stigma and how men experience and perceive stigma. um, and so women are more likely to seek help. Some other differences with men is that men are more likely to die by suicide. In fact, a rate of 4 times higher than women. Men are also a higher rate of dying from alcohol related diseases and causes. And men are also 2 to 3 times higher, more likely to misuse drugs than women. So the difference is that men are bottling it up, figuratively and literally, literally bottling it up by, seeing the rates of drug and alcohol use compared to women, and figuratively bottling it up by not seeking treatment and not, feeling comfortable or supported to talk to people about their feelings. So unfortunately, the bottling it up strategy is not effective for for recovery from mental health stressors. Hate to break it to you. Now having a beer or two after work to vent with your coworkers is one thing, but drinking frequently to numb your pain is very different. And that's what we're talking about here. Those high rates of substance use and alcoholism. And, you know, drugs and alcohol do have a benefit to the user in the short term. The issue is that in the long term, it's not going to pay off. It's not going to help your mental health. In fact, it's going to cause physical and mental health issues in the long run, like disease and addiction. And so that is one significant difference there as well. Um, Another thing to consider when we're talking about mental health is, mental health is oftentimes something that we can't necessarily see. We can't do a blood test for it. And guys can be concrete thinkers. I'm from the show me state, so I want to see it to believe it. And so I think that's an additional challenge to addressing mental health, is just that, it's these thoughts, these feelings, maybe it's not real. And so what I want to point out here is that mental health has physical health impact. So we are now learning that there's a definite mind body connection, and that our mental health is going to impact our physical health and vice versa. The importance of acknowledging this is that it allows mental health to be a little bit more tangible. It allows us to experience it in a different way. So instead of just saying, "Oh, I think I'm feeling this way," we can start to look to see, well, what impacts our mental health having on our bodies? And so we know that stress symptoms can affect our bodies, our thoughts, and our feelings. Um, and that when stress is not dealt with, it can lead to problems like high blood pressure, stroke, obesity, disease, and then, as we mentioned earlier, addiction. And so, once again, just making that important connection can allow some people to perceive their mental health a little bit differently. And maybe that's a way that you could talk to someone that you're working with, as another way to explain, how their mental health does impact them. To give a little bit more detail on different ways that our mental health can impact us physically, as we learn more about PTSD, we are starting to understand that unprocessed trauma could cause significant mental and physical health symptoms. A growing body of research indicates conversion disorder may be strongly linked to childhood trauma. Indeed, it may be the case that many diagnosed cases of conversion disorder are really symptoms of underlying chronic PTSD, which can manifest itself in a variety of ways. So, as we're learning more about PTSD, and in particular chronic PTSD, I was really fascinated with this idea in this disorder of conversion disorder. And I actually had the opportunity to counsel a woman, provide therapy for her who was struggling with this. So, conversion disorder is a condition where a mental health issue disrupts how your brain works. This causes real physical symptoms that a person can't control. Symptoms can include seizures, weakness, or paralysis, or a reduced input from one or more of your senses, such as your sight or sound. This condition is often treatable through a variety of therapies. So once again, to be clear, this is a real physical issue caused by mental health with no known other physical health issues. The person that I was working with, um, I would be able to work with her for extended periods of time. I would work with her from 9 to 3, so we were together all day long. And in the morning, she was coherent and alert, and then all of a sudden, they would become slurring their words and having trouble walking and forgetting where they were. So obviously, we wanted to rule out any medical causes, and she was able to get into a neurologist. And the neurologist, did not discover anything. And after several months of processing trauma through therapy, these symptoms were able to go away. Um, and they have come back, but not to the degree or frequency, and we continue to work on that. This is a real thing. Our mental health can certainly cause physical health issues. It's not just what is in our minds or in our heads. It is a very real issue. Okay, so like I said, I wanted to touch on several points today. So this next part, I wanted to focus on stigma. And so it's simply not true to state that guys don't have feelings. We may experience and process them differently, but we still have so why would we even think that to begin with? Why would we think that guys don't have feelings or that they shouldn't have feelings? Well, the answer is stigma. Stigma is a complex issue. I'll do my best to touch on several parts of it. Um, so, mental health related stigma is an umbrella term used that includes social or public stigma, self stigma or perceived, professional stigma, and cultural stigma. So, social stigma refers to the negative attitudes towards and disapproval of a person or group experiencing mental health issues rooted in misperception that symptoms of mental illness are based on a person having a weak character. These perceptions can lead to discrimination, avoidance, and rejection of a person's experiencing mental health issues. This is usually the type of stigma that is discussed most often. Self stigma is the internalization of social stigma in that the person with the mental health issue feels shame about his or her symptoms. And then once again, that shame would come from the societal stigma. Professional stigma assumes that health professionals transfer and reinforce stigmatization of their clients, while cultural stigma comprises the various ways that individual cultures interpret mental illness. So, those experiencing mental health issues are often considered weak, broken, less than, not strong enough. Um, and this tied with masculine norms, which we can define as social rules and expected behaviors associated with men and manhood within a given culture. um, we can really start to see how this stigma can play a role in perhaps why men aren't seeking treatment. And so we have this social stigma, and then we have these masculine norms, and then the male would internalize that self stigma. And why would we want to admit that we're broken or that we're weak or that we're less than? Why would I do that? So you don't, and continue to perpetuate that stigma and those norms of the stigma. Unfortunately, we do have evidence of this impacting our society. Unfortunately, in our culture, we hear about shootings and mass shootings. And, there have been young men that have perpetuated these terrible acts. And some of them have left messages in manifestos or posted things online, and they've talked about how they've struggled with fitting in with society, fitting in with masculine norms. Um, and that being evidence in our culture that people, that men are struggling with the stigma, and not getting help and seeking help that they so desperately need. um, like I said, this is a major topic. We could spend a lot of time on it, but I did want to give those definitions and provide that information. Fortunately, we are making progress. I think it is great that more and more people are talking about mental health, especially men. Over the last several years, we've had athletes and musicians, celebrities who have come forward and talked about their mental health struggles. John Hamm, MU grad, and smooth talking ladies man Don Draper has personally experienced therapy himself. In a Men's Health article, he said that therapy gave him a perspective, when he was lost in his own spiral. Um, Also, Chris Evans, known as his role as Captain America, has openly talked about his struggles with anxiety during press conferences. Jim Carrey's been very open about his struggles with depression, and has done a lot of work since to process his depression, and he's talked about that as well. And of course, Michael Phelps was quoted in the article saying, "I struggle more than people know. I just need to be prepared and handle it." So I think, when we're talking about stigma, it's really important to point out, these characters that portray stigma, Captain America, Don Draper, that are part of these cultural and society definitions of TV and news of what men should be like and how they should act. Well, what we're learning is that they're real people, and sure, they're Captain America on TV, but when they're, doing a press conference, they're freaking out. We could have top athletes, that are just impeccable in their sports, that still have days where they don't want to get out of bed. Um, and so the more that we can talk about that and articulate that, and to kind of separate, sure, these people play these roles on TV, and have done these amazing things. They're still human too, and they still have struggle. And by pointing that out, that can be a part of that process and reducing that stigma. Okay, so shifting gears once again, I just kind of wanted to give some synopsis of some common mental health struggles. Um, we have all struggled with mental health issues over our lifetimes. They perhaps maybe have not met a diagnostic level, but nonetheless, we've had good days and bad days. Um, Typically speaking, a diagnostic criteria, the impact of the mental health, whether it was depression or anxiety or substance use, is going to have an impact on the person's social life, their work, their school, a big a big disturbance. And so, you know, you and I have maybe, experienced anxiety or depression. But to reach that diagnostic criteria, it does, typically need to really have that direct impact on a big portion of your life. So like I said, this information isn't so we're going to diagnose anybody or do any self-diagnosis, but I did want to provide this. So if you or a loved one or someone you're working with, is having these experiences, then these are normal within these disorders, and that it would be reasonable to go talk to someone. So, major depression, we're going to have 5 or more of these symptoms in the same 2-week period. And so, as you can see there, depressed mood, loss of interest and pleasure, weight loss or gain, fatigue, feeling worthless, um, heavy guilt, decreased concentration, increased thoughts of death and suicide. And, so these feelings, these symptoms would have to be different than previous feelings, like I said, over that 2-week period, and not attributed to any medical condition. Um, a lot of the people that I work with who experience depression often talk about that lack of concentration, the hobbies that they had months before they're no longer interested in. They could care less about them. Those are some pretty typical signs that someone is starting to struggle with some depression symptoms. Generalized anxiety disorder. Um, okay, so this criteria is inaccurate. So please ignore that. I didn't get that updated in my slide. I apologize. The symptoms, however, are correct. Um, and so, like I said, we've all probably experienced anxiety, troubles falling asleep, muscle tensions, grouchiness, increased heart rate, upset stomach, lump in the throat. So we all know what it feels like to be anxious. Um, if you're avoiding situations, social events, work events, the grocery store, um, these are the types of things that would start to concern me. Um, so that's something to be mindful of if you feel like you're, kind of isolating or withdrawing due to an increase of anxiety. That would be an appropriate time to talk to someone as well. So I wanted to spend a little bit more time on anxiety, and like I said, we started talking about men, um, and this is important for men, but this can be important for everybody as well. I wanted to give a few ways to think or view of anxiety and how it would impact you. And so, the first way that I wanted to talk about anxiety is anxiety from a survival perspective. And over thousands of years, our anxiety has kept us alive and well. It's fine when we need that extra heart rate and energy and lack of focus and concentration. So we're only doing one thing when we're running from a saber-toothed tiger or our village is being raided by a Viking clan. Anxiety is very helpful in these situations. There are real threats and real things worth running from. The issue is that the same system is going off in our bodies when we're talking to our boss or getting a bill in the mail. Our bodies are reacting to that stress in the same way that it would as though we were being, physically attacked by, a saber-toothed tiger or something. And so, like we know with anxiety, that's going to increase our heart rate. And what we're learning and what we know is that with this boost of anxiety and adrenaline, it's dumping cortisol into our system. And when our body doesn't have a natural way to fight this off, that cortisol is actually building up in our body, and that is in part of what's causing some of these physical health issues. And that's, a part of the mind body connection, is that this untreated stress and anxiety is just continually putting you into this system that's releasing chemicals with no proper way to express that, and that can cause a lot of problems. So there are ways that we can address our anxiety. I will talk about that a little bit more later on in the presentation. But I did want to acknowledge that that is one way of viewing anxiety. It's there for a reason. It's important. It's worked for us. But when we're having it over smaller things and not appropriately addressing it, then that stress can build up over time and cause physical and mental health issues. Another way of looking at anxiety, we'll do a short video on the anxiety cycle. This way of viewing anxiety is more about avoidance and how that system embraces a behavioral pattern, and how that pattern can be negative for us.
Have you ever not done something that you really wanted to do because you felt nervous or anxious about it? Like maybe going skydiving or traveling around the world to a country whose language you don't speak. Or maybe something more day to day, like asking someone on a date, or just stepping out of your comfort zone and doing something that you wouldn't usually do. When you don't do these things, when you don't face your fears, anxiety has a tendency to grow. And this is explained by something called the cycle of anxiety or the cycle of avoidance. The first step in the cycle is anxiety. This step begins when you're first confronted with that thing that makes you feel nervous or afraid or anxious. When you're confronted with this, you start to develop these uncomfortable symptoms. These are the symptoms of anxiety. Things like a racing heart, butterflies in your stomach, sweating or trembling, or just thoughts of being overwhelmed or afraid. When you start to feel these symptoms, the key point is that you really want to get away from them because they're so uncomfortable. You just want the symptoms to disappear. The second step in the cycle of anxiety is avoidance. When the symptoms of anxiety get to be too much, too uncomfortable, it becomes really tempting to find a way to get rid of them. And the easiest way to do that is to just avoid whatever's causing them. Now, physical avoidance is one way to do this, and that's just to remove yourself from that situation. So, for example, someone who doesn't want to give a presentation at work or school, they might skip class or call in sick to work so they don't have to do it. Another form of avoidance is emotional avoidance. This is when someone faces that fear, but they find a way to suppress that anxiety or the emotions that go with it. A good example of this is someone at a party who's shy, doesn't really want to talk to people because they're nervous, so they drink until that anxiety goes away. That way they can avoid the uncomfortable emotions. Now, avoidance isn't always bad. Most of us have a healthy level of fear about things like snakes. We might not go stomping around in tall grass because we don't want to get bitten. And in those cases, avoidance can actually be a good thing. The third step in the cycle is short-term relief from anxiety. What this means is a person's made that decision to not face their fear, and it works. They get that relief. Those symptoms, they go away. You make the decision to skip your presentation, you get to stay at home, lie on the couch, watch TV, and it feels really good. The problem is that relief, it's short-lived, and it has costs that come with it. If you skip work, someone else is going to get that promotion over you. You skip school, you're going to get worse grades. If you don't ask someone on a date, you might miss a great opportunity. This brings us to the fourth and final step in the cycle, which is long-term anxiety growth. What this means is you've avoided that thing that caused the anxiety, the symptoms went away, and the anxiety lessened, But then in the long term, the anxiety actually grows. This is because when you avoid something, the brain learns a simple lesson. It learns, when I skip school, I feel good. When I skip work, I feel good. When I don't face my fears, I feel good. Every time you do that, it becomes more and more ingrained, and you become more likely to avoid something in the future. To break out of the cycle of anxiety, all you have to do is face your fears. Of course, this is easier said than done, but every time that you face them, it becomes a little bit easier. Your brain learns the opposite lesson. It learns, I faced my fear and it was okay. Now, a mental health professional can help you with this by gradually exposing you to those fears in a safe way, starting with something smaller and working your way up. If you practice this enough, you can overcome your anxiety.
Okay, so in therapy, we would call that exposure therapy, where you're slowly exposing yourself to those things that cause anxiety. And that is a great therapeutic technique that can help reduce anxiety. Okay, so moving on from there, I wanted to provide some support on what we can do. Whether we're the ones that are struggling with the mental health issues, or whether we're working with people or working with family that we might suspect of struggling. I wanted to give some ideas and some strategies that we can do. So, as we've been talking about, stigma is very important, so mind your mouth, despite what you think or hear, you're not crazy, you're not weak, you're not less than, you're just a person struggling with anxiety, struggling with some down days. We're all just doing the best we can as we travel 67,000 miles an hour around this wonderful sun. So, give yourself a break, and know that there are some things that we can certainly do to help the people that we care about and help ourselves. So, cognitive behavioral therapy is still a very popular therapy. The idea is that our thoughts are going to impact our emotions, and our emotions are going to impact our behaviors, and there it goes into that cycle. What we saw with that anxiety video that we watched is that, oh, I'm thinking I have this presentation, I'm feeling anxious about it, therefore I'm going to avoid it, which is the thought, the emotion, the behavior. And then the behavior could reinforce the thought that, like he was saying in the video, oh, that felt good, I didn't have to do that. Well, it could life could pass us by while we're doing that, or it could, embrace thoughts that, oh, I really can't do this, or that I'm unable or incapable. And so that's the basic idea of the cognitive behavioral therapy. One of the tools that I like to use when working with guys is the thought diary. Now, I use this with everybody, and I use it with myself. Um, but the thought diary I really like because it's very concrete. It's listed out. It's ABCDE format. When you're working with guys that, maybe struggle to articulate how they're feeling, or they say, I'm just angry, and I only have one emotion, I'm just angry. This can be a great way to get a little bit more information out of them. Um, you know, allow you to see where they're coming from, and allow them to process. Um, so basically, with this thought diary, you're going to talk about the activating event, so what caused the issue, and then the statements that we make And you would want to have them list those statements and, what are they saying to themselves? What's going through their heads? And then they can underline the most distressing one and rate that on a scale of 0 to 100. The consequences then are going to be not only, our emotions, but also down here for our physical sensations. And so, here you can tie some of the mental health or the emotions to some physical sensations and say, hey, when this happens and you think this, your heart rate increases. That's a physical symptom. Um, and then this is a list of unhelpful thinking styles. The the second page to this and is the disputation or the detective work. And so you take the hot thought from B, um, and then you work to provide evidence for and against that, while also asking yourself, what would others do in this situation? If I wasn't feeling this way, how would I view the situation? What would I tell someone in this situation? Um, what are some helpful things that I can say to myself? And once again, we're making it a little bit more concrete, to process these thoughts and feelings that were just in our head. Now we're really putting them on paper, analyzing them, providing evidence. And then at the end, what we want to do is to create a balanced thought. Um, and it doesn't have to be super positive. It doesn't have to be full of roses and flowers. It just has to be balanced. So we don't want it to be overly negative or really even overly positive. We just want it to be more balanced and supportive of the goals that you're working on achieving. And when I do this with people, 9 out of 10 times we're able to reduce their anxiety or their emotional number that they rated on that first page. Oftentimes they tell me, I'm at 100, I'm at 100. And usually we can get it down to a 50 or lower by the time we're done with this thought diary. I also tell people you might need to do 20 thought diaries a day, for each distressing thought, or you cope with one distressing thought and another one comes up. Well, do another thought diary. That's okay. So this is a great tool that you can use for yourself, for people you're working with, to really make the issue concrete and measurable. Um, One of the other techniques that I like teaching people and talking to people about is the 5-finger breathing technique. What we know is that when our anxiety is triggered and we're put into that fright flight mode, it's activating the parasympathetic nervous system, and by doing breathing exercises or grounding exercises, we're actually communicating with our brain to let it know that we are not in danger. Because when you are taking conscious effort to breathe and to ground yourself, you're able to send those signals to the brain that, okay, we can relax. And we know that we can relax because we're breathing. And so this is a great skill. The Cleveland Clinic has some really good informational videos in some science they've done with patients going into surgery and using this in the pre-op to help reduce those anxieties. So that's worth checking out. Another grounding technique that I use a lot, once again, it's very concrete, it's very physical, it's very tangible. So that can work well with people or with guys who struggle, with the more abstract. And so once again, this is going to communicate to that nervous system that we are okay, because we do actually have that time and the luxury to acknowledge 5 things that we see, and to focus on the texture of 4 things that we can touch, and to pay attention to 3 things that we can hear, and 2 things that we can smell, and 1 thing that we can taste. This grounding technique can be done anywhere, um, really quickly, really effectively, to help reduce that anxiety. So in my office, work with several younger men, and almost all of them want friends. They don't have friends. They want friends. Um, they don't know why they don't have friends. Um, and that is a huge impact on their mental health. And you know, I think guys tend to be a little bit more or less social, one reason or another, and that is a struggle that I've encountered when working with younger men. And so I did want to note that, self care, community, and spirituality is also ways to help people. um, so getting regular exercise, healthy diet, sleeping. Maybe you're working with someone who really values their diet and their exercise, but maybe doesn't take as good a care of their mental health. And it's like, hey, you go to the gym every day, you spend an hour on your biceps. Why don't you spend 10 minutes doing some relaxation, or every Wednesday get out with a social group, or do some meditative activities to help you stay connected and focused. So you can start by asking yourself, what do you like to do? What are your hobbies? In 2023, so last year, the Surgeon General released a major report detailing the negative health impacts of social isolation. And so, when these young men, or, people in general, are saying, hey, I don't have friends, I'm not getting out. Um, we now know and have evidence from this report that social isolation is a tremendous mental health and physical health factor, and can, negatively impact someone. Um, so whatever your hobbies are, you know, you can focus on those. Here is a link, meetup.com. It's a website where you can find open events and activities in any city. I listed the one for Kansas City, and you can search, with your clients or for yourself, different activities that you might be interested in. I also recently learned about this Global Compassion Coalition that has a lot of great information, working with men and working to build compassion and address masculinity, and really support the male in that process. So that is a recent resource that I came across as well. Speaking of mindfulness, just want to be mindful of everybody's time and respectful of that. So we'll probably start wrapping up so we have some time for questions. Mindfulness is another skill that we can use. Mindfulness is, Marsha Linehan, the creator of DBT, or one of the creators of DBT, said mindfulness practice is the intentional process of observing, describing, and participating in reality non-judgmentally in the present moment. And the key there is non-judgmentally. So if you are having these feelings, and society's already saying that you're weak and less than, we don't need to do that to ourselves or to the people that we're working with. And so when we're teaching mindfulness or practicing mindfulness, remember that your thoughts are just thoughts, and they're just there, and you can acknowledge them, in that moment, but you don't need to place judgment on them. For the sake of time, we won't show these videos, but I show these videos with pretty much everybody I work with. These are some DBT skills, but they do really well to articulate how to practice mindfulness. Um, a lot of people have different opinions of what mindfulness is or isn't, or how to do it. These videos are like 3 minutes long. They're super helpful in describing. So there is the how skills and in the what skills. You can just YouTube these videos, DBT, how and what skills, and they usually are the first ones to pop up. Okay, so, to wrap up our conversation, avoid avoiding. I had a roommate that always told me there's nothing to it but to do it. I hated every time he told me that, but it's true. I can't get around it. I can't argue it. He was right. And, so we can start by being honest with ourselves or the people we're working with or the loved ones in our family, and you know let them know that it's okay to have feelings. It's okay to have days that aren't as good as others, and that if we've been putting it off or that we thought we should have done something, encourage them to do that, and really empower those people that you work with or yourself or those around you to you know feel empowered to get that help and to seek the treatment that they need, and that they're not less than, and they're not worth less. And just like someone would go to the gym and take pride in that, why wouldn't we take pride in our mental health? And so there's lots of mindfulness apps you can use. Of course, calling your insurance company to see if there's therapists that take your insurance in your area. Um, we're obviously part of the community mental health network of the region. And so, reach out to a community mental health provider in your region. And then, of course, 988 is the crisis and suicide hotline. But you can also call that and get information on mental health and places to go. So, well, I want to leave a few minutes for questions. So thank you all so much for participating in today's webinar. And I will go ahead and take some questions, and we can wrap up around 1 o'clock.
Yeah, Matt, this is Dan Ryan, but I've been keeping an eye on the chat, et cetera. And one question we got was access to that thought diary form. Is there a place to get that you know of, and any resources and references regarding it? People were enjoying that.
Yes, absolutely. This thought diary actually came out of an organization from Australia. And if you Google search thought diary, there is tons of them. I don't have the link on this handy, but it is an Australian company, so it's not a .com web address. So as you're searching thought diaries, look for that. And then my email, I'll go ahead and move to that last slide. Feel free to email me, mattb@beaconmh.org, and I'd be glad to send you all. I have a PDF of this. I keep a bunch of them printed in my desk for working with people, so I'd be glad to get those to you as well.
Excellent. And as a reminder, this webinar was recorded, so people can access it on the mentalhealthkc.com website. And you can also access your certificate of attendance as well. I put that in the chat, how to access that. I could probably put it in again if people don't want to scroll up. Looks like we had somebody track down the thought diary already.
Nice.
Any other questions? Matt, this is really a helpful and informative
Dan.
and thoughtful presentation. And obviously people in the comments are agreeing with that.
Oh, good.
Any
Thank
other
you so
questions?
much.
Yeah. Can we add the YouTube link to the chat? I don't know if you've got that, Matt, handy.
YouTube link to what chat? I'm sorry.
Jen, do you which YouTube link were you looking for? Oh, it looks like Marissa Thomas already has that.
Nice.
Talking about avoidance. Yeah, we've got a bunch of internet sleuths on this program.
Yeah, we
That's
do.
great.
That's great.
Thank you.
Yeah, that therapist aid was that anxiety cycle video. And therapist aid website has tons of free printable things for therapists. And so that's worth looking into as well.
All right. Any other questions? It's neat how people agree on using different. That's a good question on the public domain. Do you know if those are public domain
The thought
resources?
diary.
Yes.
Yeah, absolutely. Yeah, you can download those. Um, it's like a government funded Australian organization that put that out. And like I said, email me and I'd be glad to get that because they, like Therapist Aid, have tons of resources that are free to download. I use their information all the time. It's quite amazing the research on mental health that's come out of New Zealand and Australia. It's been pretty progressive. So I do use those resources quite often.
That's great. We should schedule a forum sometime where everybody comes and shares their favorite resources.
That would be a great idea. Well, thank you all so much for your time. And, those guys around you might pretend to be tough, but they're a little softer than you think. So, so we appreciate all the support we can get.
Thank you so much, Matt. And thank you to everybody for attending, helping to organize these things. It's fun. And we really appreciate it when people come and take advantage of the great resources we have right here in our own community. So thank you, everybody, and see you in, I guess, about a month.
All right. Thank you, Dan.
Thanks.
Thank you, everybody.